Welcome to MGH Rheumatology. Thanks for your interest in our fellowship training program. My name is Marcy Bolster, and I'm the program director for the Rheumatology Fellowship Training Program at Massachusetts General Hospital. I thought I would share with you a few highlights of our training program. Here's an overview of our topics, and I know that I won't be able to provide a comprehensive description of each of these, but I hope to share with you a few important aspects of each of these components. We have clinical training, conferences, research development, the fellow as teacher. I'll also talk about building your career, diversity and inclusion, the MGH family, and life in Boston. Let's start with the outpatient clinical experience for our rheumatology fellows. Our fellows have ownership for their own patient panel. Each fellow works with one faculty member for each of their panels, and in this way, there's continuity of care for the patient with the fellow and also with the faculty member, and the fellow knows which faculty member with whom to discuss for any of the specific patient questions that may arise between visits. The patient panels for our fellows are enriched with interesting cases. All new patients for fellows are scheduled as either semi-urgent or urgent referrals. This means that the referral was made within the past 2 weeks and demonstrates a higher acuity for rheumatology evaluation. Additionally, our preceptors are often referred patients into their area of expertise or patients that are particularly puzzling to the referring provider. And these patients can be placed or scheduled in the fellow's clinic when working with that preceptor. We have outstanding support resources, including we have nurses who screen all messages that come in through the electronic medical record. Prior authorizations are performed centrally. We also have subspecialty clinics for our fellows to rotate through, including osteoporosis and Rheum. We also have a vasculitis clinic and Lyme clinic and other subspecialty clinics that are available that may fit well with the fellows training program. I'd like to say that we like to really personalize the fellowship training to the fellow. Every fellow has different interests and needs for their own professional growth, and we like to be able to personalize this for the fellow. Each fellow has one half-day clinic per week that's a continuity clinic throughout their entire training period. First-year fellows average 3 clinics per week, but they only have one half-day of clinic when they're on the consult service, and this is a morning clinic to permit easier transition to the consult service responsibilities that day. The second-year fellows have 1 to 4 clinics per week, depending on whether they are a clinical fellow or a research-based fellow. Fellows who have a focus on research have fewer half-day clinics each week in their second year. In terms of the consult service, there are always 2 fellows on the consult service. First-year fellows spend a majority of the year on the consult service, and they rotate as short and long call fellow. The short call fellow is done with attending rounds by 4 or 4:30 in the afternoon to allow them to follow up with the teams, to go back and call patients to finish up their notes. And this is balanced in terms of a 2-week consult service rotation for fellows where they have half of the time as the short call fellow and half of the time as the long call fellow. And the long call fellow takes call in the evening. We also incorporate 4 to 6 weeks for research planning in the first year of fellowship training, and each fellow has 4 weeks of vacation. For second-year fellows, again, there are always 2 fellows on the consult service, and there is a short and long call fellow, with the short call fellow being done with rounds by 4 or 4:30. Typically, when a second-year fellow is on the consult service, they are rotating with a first-year fellow. The second-year fellows have 1 to 3 2-week rotations on the consult service, and this is based on whether they are a clinical fellow or research-focused fellow. And similarly, second-year fellows have 4 weeks of vacation. Let's talk for a moment about our conferences. We have a very robust conference schedule. We have case-based interactive conferences. We also have interdisciplinary conferences that includes the interdisciplinary conferences occur with pulmonary, pathology, radiology. We have a vascular radiology conference in which we focus on patients with systemic vasculitis. We have interdisciplinary conferences with our neurology colleagues and neuro-ophthalmology colleagues. We also have cutting-edge conferences, including Grand Rounds, Journal Club, and Rheumatology Faculty Research Conference. The Bread and Butter series fills in important curricular elements, which may not be met through other clinical activities. This could include something like learning about interpretation of pulmonary function tests, or having an orthopedic surgeon come speak to us about total joint arthroplasty, or having an occupational therapist come and teach us about the use of splints. We also have meetings that are important for faculty connections. We have Meet the Faculty, which is a meeting that occurs with one faculty member and the whole group of fellows. And this is an opportunity for the faculty member to highlight their path through their professional development, to share their ongoing research ideas, to establish potential mentorship for fellows, and to really offer an informal setting for fellows to learn about each of the faculty members and their role in our division. We also have Let's Meet, and this occurs for Let's Meet for breakfast and Let's Meet for lunch. And this is a time when 2 to 4 faculty members meet with our whole group of fellows and enjoy breakfast or lunch. And this is social, informal, and just an opportunity to gather. In terms of research development for our fellows, there's time in the first year of training to set up the research plan. This is a time where we encourage the fellows to interview faculty about their ongoing research and areas of interest. I'm certainly available at any time to meet to discuss research interests and development. Similarly, our Associate Program Director, Eli Miloslavsky, and our Division Director, Andy Lester, are also available to meet to talk about research opportunities. I would say that any of the faculty would be happy to talk to you about your ongoing interests. We do have a structured fellow career conference half day, and this is a time in the fall when our first year fellows join faculty mentors who introduce the ongoing research in different areas in terms of medical education, clinical research, and basic science research. This is followed by a panel that morning with the second and third year fellows who can describe their ongoing experiences in any of these areas. And finally, there's a lunch for our first year fellows with our junior faculty to talk about their specific paths in their professional development. Typically, the fellows find a mentor in the early to middle part of the year, and by mid-year are able to compose a hypothesis and specific aims, which really allows them to make the proper preparations in the next several months to be able to hit the ground running in July of their second year to start on their research projects. The fellow as teacher is a high priority within our fellowship training program. We do have a formal curriculum called FACT, the Fellow as Clinical Teacher, and this is a curriculum that was developed by Eli Miloslavsky, our Associate Program Director, and this curriculum really starts right at the beginning of fellowship training. It's an opportunity for fellows to learn about how to optimize their teaching when being involved in the clinical care of patients, and so this ultimately relates to a great extent, the fellow interaction with the internal medicine trainees and how to provide ideal teaching and capture that teaching moment. We also have a conference on presentation skills. This is an annual and interactive conference where fellows learn more about presentation skills. And we provide strong faculty support with slide preparation for any or all of the presentations that fellows may be giving. For our second and third year fellows, each of them will present at Rheumatology Grand Rounds, and we have a formal feedback process from really all attendees to provide to our fellows who are presenting. And we do also offer precepted didactics. And in this way, faculty and fellows are paired for case-based presentations. These presentations are offered to our own MGH internal medicine practices, to the North Shore Medical Center internal medicine trainees at their noon conference, and also to the Rosebud Indian Sioux Reservation primary care providers. And in this way, the fellow and faculty member identify cases that would correspond to a certain clinical topic to provide good educational support. And then the faculty member can help with the slide preparation and in fact attends the conference with the fellow to be a panelist while the fellow is presenting, to provide backup for any questions that may be difficult to answer, and then also to provide the fellow with formal feedback after the presentation. Our fellows have the opportunity to teach Harvard Medical School students in the physical diagnosis course, and we also offer a workshop for hand examination for the students to examine the hands of patients who have arthritis. Our fellows also participate in teaching the internal medicine trainees, including RES report, which is resident report, and is a whiteboard type of conference where the residents present a case and the fellow will walk them through the clinical reasoning and critical thinking that could be involved with the care of that patient. Our fellows also are invited to present at noon conference for our internal medicine trainees. In terms of building your career, we offer superb clinical training really across the spectrum of rheumatic disease. We also have a high priority placed on mentorship. As I've described, we have a structured approach to your research project planning. And in terms of mentorship, we really have a huge focus on abstract, manuscript, and grant preparation in a very guided format. Many of our faculty are involved in the American College of Rheumatology, and we encourage our fellows to also get involved with the ACR. And we also have opportunities for advocacy, both at the state level and at the Capitol Hill level with the ACR, who provides the training and teaching that gives us the, I guess, information on topics of interest on Capitol Hill and provides us with a day's experience for those who are interested. In terms of building your career, importantly, the first and second year provide a time for you to really define your interest and explore these areas of interest. In the next year, second and third year and beyond, we provide guidance and development for your transition to faculty and really ensure your readiness for faculty and clinical practice entry. There are many opportunities at MGH for you to consider as the foundation for building your career. We have strong mentorship in clinical research and basic science research and medical education training and leadership. There are leadership opportunities for fellows in hospital committees and quality improvement, in the Women in Medicine Trainees Council, within the Department of Medicine, and also with outreach to underserved communities, both locally and nationally. We have a community health center network in Boston, and we also have a collaboration within the Indian Health Service with the Rosebud Indian Reservation in Rosebud, South Dakota. In terms of diversity, equity, and inclusion, I'd like to say that we are a general hospital, and this I guess goes without saying, but in this way, we really serve our community. We provide care for socioeconomically and an ethnically diverse population, and we also serve as a tertiary and quaternary referral center. We provide care for patients from over 140 countries, and we have an incredibly strong medical interpreter service. This provides interpretation in over 100 different languages, including the American Sign Language. As mentioned, we have a community health center network, and this not only provides us with a referral base, but it also provides an opportunity for our fellows to rotate through the Chelsea Community Health Center. And in this community health center, the adult population is extremely diverse, and many of the patients have Spanish as their preferred first language. There are many ways for fellows to become involved in diversity, equity, and inclusion. We have had several fellows be the lead for the Women in Medicine Trainees Council. Each Department of Medicine division, including rheumatology, has a DEI lead, and we have a DEI working group in which fellows can also be involved. I thought I'd share a few pictures with you of the MGH family. We certainly work together, but we also gather together outside of work. And you can see our annual Fellows Welcome Party, our holiday party. We gather at the ACR reunion. We're involved in community education and outreach efforts such as the Arthritis Foundation Walk. And I enjoy hosting each year the Boards Are Passed party after our first year fellows take their internal medicine boards. In fact, we gather at my house at least twice, sometimes 3 times a year, because it's so important to gather and to learn about each other and spend time together. And we all enjoy the good food and company. Life in Boston, our trainees have the highest salary in the country. There are many great neighborhoods just within walking distance or an easy T-ride of MGH, and Boston is a great place to raise a family. There are also sports, concerts, activities, festivals, and very close by, there's skiing, easy access to hiking. We're close to the beach. We have lakes and we have rivers. Here are a few photos of different areas in Boston, out in the suburbs. It's quite beautiful and wooded. Walden Pond is located in Concord, Massachusetts. You can see Cambridge across the Charles River from us. There's great food, there's great sports. The Boston Harbor is beautiful. And as you know, we have the Boston Marathon. Thanks so much for your interest in our program. I hope this has been informative for you, and I would be very happy to answer any questions you may have, so please feel free to be in touch.